Hi, I'm Dr. Greg Cantu. So what I want to talk about is a powerful option to using medications for learning problems and alertness and attention. I have a lot of kids and adults that come into my office and they're already on medication. So if the brain starts to work better, you have a much better chance of working with your physician to reduce these. They may be causing side effects. Sometimes side effects are present, but because they've been used over time for such a long time, those connections between the actual side effect and how it's making you feel poorly during the day or maybe interfering with sleep, the connection isn't really made, okay? This is a really good option to look at, to do neurofeedback, to get a proper, thorough evaluation, and to get your child's brain or your own brain to work as well as it can before you look at the medication option. One of the things I've noticed, because I've had many patients come in, and some of them have been on medications for as long as 20 years, is that the medication isn't working to resolve their symptoms. So would it be a good thing to look at another option? Absolutely, but why isn't it working? Why isn't it doing what it's supposed to do? We do use supportive therapies in the office to help balance brain chemistry in the way of nutrition, to magnify the effects of the healing therapies. It is not merely to keep somebody on this supportive brain therapy for a long time. When a doctor or physician gives you a thyroid medication, the intent is not to leave you on it for a little while to get your thyroid working better and take you off. So the idea with medication is to actually support you, and it has to be taken. As soon as you stop, that changes. So when I look at a child or an adult that is taking medication, what's actually happening is they're a different version of themselves, the way I look at it. They're actually being supported by chemistry to function at a different rate. And when you stop it, in some cases, some people may actually feel as good if they weren't taking a lot of medication or it wasn't very powerful. But in some cases, they're going to be very different. That's the real person. That's the real child without the medication. So you need to work with your physician to see if you can wean off your medication if you're feeling better. That's between you and your physician, right? But you can add these options while you're doing that, or before you take a look. Try the more natural option, that's my recommendation, and see if you can get your brain to work the way it was intended to, because at the root of a lot of brain dysfunction is old head traumas. Even emotional traumas can impact how the brain actually functions. And we see changes take place all the time. It's non-invasive. It's very easy for the patient to go through the process. We do have a very objective way of looking at brain energy to make sure that it's changing, to make sure that we regain balance. It's all very safe and effective. Bring your child in. Come on in. We would love to talk to you and give you the options, explain step by step what would fit good for you as far as our process goes. So go to brainandbody.com, check out neurofeedback, check out functional neurology, and you can give a call, 858-794-8855. Thanks.